two big reasons that taking care of your soft tissues are hugely important to your conditioning. The first is that soft tissues ultimately are what are allowing your body to move freely, and that means better mobility equals more efficient movement most often, and therefore your conditioning is going to get better just as a result of having that added mobility and functionality. Secondly, if you can't train, you can't improve. And if you don't take care of your soft tissues, you're increasing your risk of injury. And of course, if you're injured, you're simply not going to be able to train the way that you want to, and your results aren't going to be what they could be. So taking care of your soft tissues is a really, really important thing that literally everybody out there that's training needs to be doing on a consistent basis. So my purpose here is to walk you through some basic strategies of exactly how to do that. It starts with understanding, again, why do we take care of our soft tissues? Well, because our goal is to decrease, again, the stress in our body when we're not training and turn on that parasympathetic system. And a piece of this, at least, is tied to our muscular system and all supporting structures. So if our soft tissues are healthy, we are more likely to be able to turn down that stress response and vice versa. Our soft tissues are also linked to our autonomic nervous system in the other way. If we are stressed, it makes our soft tissues tighter, less pliable, and less resilient. So they go hand in hand. Our goal here is to turn down, again, that sympathetic system when we don't need it, and turn on that parasympathetic system when we do need that for the recovery end of things, and the soft tissues play a role in there. The other thing, like I mentioned a minute ago here, is better mobility gives the body more movement options, like we talked about earlier. This means you can have more efficient movement, and this means you lower the cost of moving. So the lower the cost of moving, the longer you can move without fatigue. It really is that simple. So having efficient movement patterns and having the ability to repeat those patterns over long periods of time, is a really important part of conditioning, and mobility plays a role. And then, like I said, having injuries is about the worst thing for your conditioning because you can't train. And conditioning needs a fairly high frequency. You can lose it fairly quickly. The old phrase, if you don't use it, you lose it, really is true with conditioning. Unfortunately, it decays much quicker than strength. So if you get injured for a week or 2 or 3 or whatever, and you can't train consistently, your conditioning will go down the drain fairly quickly, unfortunately. But the good news is you can also get it back quicker after you've already had it than if you never had it to begin with. So let's talk about how do we actually dig into this. Well, look, there's lots and lots of different types of soft tissue work. I'm going to go through essentially the basics of the ones that I use, again, and give you a framework that you can use to operate however it is that you want to take care of your soft tissues. So the first one here is what I would call instrument-assisted soft tissue mobilization techniques. Kabuki Strength has really popularized this along with Donnie Thompson and some other powerlifters. But the best way to think about IASTM essentially is foam rolling or trigger point therapy type stuff on steroids. And there are a variety of tools out there for it. But the biggest reason I like this type of work is because it gives you the ability to really focus on different areas and cause a real effect without having to always rely on a massage therapist or professional in this regard. So Kabuki Strength, again, they're my go-to resource. You can go to their website, look them up. They've got endless videos, endless drills, endless different ways that you can incorporate their tools. But I use them literally on a daily basis to keep my soft tissues healthy, and the people I work with do as well. And I think they're highly, highly valuable and something I recommend. Now, again, another tool here, well, I'll give you a recommendation, but there's lots of tools that can do the job for just trigger point type, more precision work. And this often goes hand in hand with the larger implements that Kabuki sells and other similar type devices. But I love the Active Mobility Balls. They are, to my mind, the best out there for just self work as far as myofascial release and trigger points and all these things, because they're incredibly easy to position in different places, just given their shape and their design. I also really like Active Mobility because they give you a lot of education as well with their tools. So I like to support companies that will not just give you a product, but teach you how to use it. These guys are the real deal. So if you have a favorite tool out there, even if it's a golf ball, tennis ball, or one of those things, great. But if you really want to get something I consider the best bang for your buck and a great tool, Active Mobility is really, really valuable. And again, these are all self myofascial release or self trigger point therapy. These are all types of methods that you can do for yourself. And I really recommend becoming proficient in that, because it's not practical to expect, unless you're a pro athlete who travels around with a massage therapist, it's not practical to expect that, once a month, having someone come in and work on you even once a week is really enough to keep you healthy as you progress in training and age and everything else. So being aware of how to manage your own soft tissues and incorporate it in your training is going to go a really long way into keeping your soft tissues healthy, keeping your joints mobile, and overall making sure you're able to stay in the gym. And then the third category of devices and techniques and tools here is percussion therapy. This has obviously become very popular in recent years. There's lots and lots of devices out there now, Theragun and Hyperice, of course, being the two biggest. I'll leave it to you to pick which one you would like to go with, or there's other alternatives as well. But there are some benefits to this type of percussion therapy as well. I think it's a good adjunct, not a replacement for the other two types of methods I just talked about, but they can be, again, a symbiotic relationship where you're able to use all these different soft tissue tools depending on the soft tissue needs you have. So there's a difference between soreness versus maybe mild injuries versus rehabbing versus all these other different areas of fitness and training. So the right tool for the job is something that's going to depend on what job you're talking about. But again, being proficient and aware of how to use all of them is ultimately going to give you the most versatile tool set in order to keep your soft tissues healthy. Now, as far as timing, this is a really important piece of this. Again, you have to make these things consistent. So pre-workout, I'm going to be doing a variety of things to stimulate blood flow, to activate muscle, and to improve mobility. So I'm not going to go in the same level of direction in terms of proprioceptive feedback, or the same level of pressure, the same level of stress as if I'm doing something in between workouts if I'm about to do a workout before it. So you want to just, again, it's more about light pressure and stimulation and blood flow and mobilization with any sort of soft tissue treatment or any sort of soft tissue strategy before the workout. So keep that in mind. You're trying to help the body warm up and just loosen it up. So if there's something tight, I'll throw an active mobility ball on there, get it moving, get it mobile, get it loose, and then I'll go train. So I'm not going to do any more than that. I'm just going to make sure that I feel good and mobile and able to move before I do my workout. Now, after my workout, that's a bit of a different story as well. My goal here is to relax that sympathetic system and support the circulatory type thing. So this is where I'll use some of the Kabuki tools in a much lighter but more stroking type manner to help clear the circulatory system or help the circulatory system do its job. And I'm going to focus more on, again, the relaxation type work here versus the stimulation higher pressure. So I should use these tools, or you should use these tools, use these different techniques at the end of the workout to promote that circulatory capacity and to promote that turning off of that sympathetic system. Now, between workouts, this is where you can get more into these different areas. Again, your goal here is to promote blood flow, relaxation, range of motion. So if you feel any areas that are extremely tight or you feel knots, your movement's not what it needs to be, this is where trigger point therapy, all these tools can come into play to help loosen them up and keep them moving freely. So you want to make sure, again, that you're doing these things consistently. The other thing is between workouts can help sleep. So I typically do a 10 to 15 minute little session, soft tissue session, 20, 30 minutes for bedtime. And I found that helped me turn that sympathetic system off and get better sleep or go to sleep faster. So you can incorporate the soft tissue strategies using any one of these tools or using all these tools. You can do it before your workout, you can do it after your workout, you can do it between workouts. The reality is you should be doing some level of it on a daily basis. Okay, it's up to you to decide how and when you want to incorporate these tools, but I'm telling you that if you're training at any high level, making sure your soft tissues stay healthy is a big part of staying in the game. And again, getting the most out of your efficient movement so that your conditioning can be what it is, or what you want it to be, I should say. So if you're not doing any sort of soft tissue work right now, I would suggest getting started with the simplest thing. If you don't want to go out and buy something new, find a golf ball, find a tennis ball, go to YouTube, look up myofascial release, trigger point therapies. You can find 1,000,001 different strategies, different methods, different exercises, different tools to do this, but just get started doing something and you will gradually evolve over time in the tools you use and the way that you use them. But if you're not doing that, I highly recommend doing it. If you are already doing it, looking into the tools that I mentioned, I think will be a great adjunct to what you're already doing if you're not already using them, and they've proven effective for both myself and the people I've trained over the years. So I highly recommend checking them out. So that wraps up this section. Finally, to finish off this module, we're going to dive into using HRV, understanding what the HRV number you get is telling you, whether it's with Morpheus Nerve System, and then how you can use that to make sure that your recovery is on track. All the strategies we've talked about throughout this entire module are helping you improve your recovery and thus driving your conditioning.